Hi everyone, I'm Dr. Casey with Birmingham Health, and today I want to talk with you about a patient of mine that was receiving acupuncture care from me. Well, one, his history has got to include a lot of neck pain that he's had for many years that included headaches as well as radiating pain from his neck all the way down into his fingertips. And he had seen a lot of different type of physicians where it included chiropractic care. He's seen pain management. They even sent him out for physical therapy for a period of time. And he was doing a lot of these things that may have just kind of chipped away at it, but he never really got the relief he was looking for, and it never really was sustainable. It would always come back, and it would come back with a vengeance. And it was getting to a point where it was incredibly affecting his life, to the point where his quality of life was so low, he wasn't doing the things that he enjoyed to do. He wasn't seeing the family he wanted to see. And so one of the things he ended up finding out was that, searching out some acupuncture stuff on Google, and it brought him to my page. And so he called me up and we started talking about it. And I said, well, there's a lot of things that acupuncture I think can be beneficial for you. But I also think that there's other puzzle pieces that need to be included kind of at the same time while we're doing this to give you the best outcomes. And in his case, we did decompression, chiropractic care, as well as some acupuncture. And what he saw was more immediate reliefs that were more drastic, and they ended up being more sustainable for over a period of time, to the point in time where he was only a 9 out of 10, dropping down to a 6 out of 10, dropping down to a 4 out of 10. But then he was just staying at those levels, and then he would drop down to a 2 out of 10. So he was going down a good route, and it was sustaining for him, which he has not experienced over the many years that he's been getting treated. One of the things that was the biggest issue for him was that he had been getting almost 17 injections over a 4-year period of time. That included epidurals and trigger point injections, and he was just like, my God, I cannot take another needle. Well, here in the next little clip, I want to show you the actual insertion of the needle and show you not only how minute that needle is, but how comfortable it is, and to show you kind of a little bit more things to expect when you come in for acupuncture. Again, as you can see here, here's the needle in the feeding tube. We'll insert the needle into the feeding tube. We're going to pick an acupuncture point that's commonly used for many areas here. And you'll see again that I'll just slightly apply a little bit of pressure with the feeding tube, slight tap of the needle, and now the needle is in. Some areas will you have to include some degree of further insertion, but see, all I feel right now is maybe just a light bit of pressure, as if somebody was pushing their finger onto my area of the hand through there. Not in very deep, very thin and minute, and then we're just going to pull it out. Very comfortable. Well, now that you guys seen that little video, if you got any questions about how acupuncture might be able to help you, or if you got any other types of questions about what kind of puzzle pieces all need to be put on the board at the same time, just give us a call at the clinic. You can reach us at 205-385-9999. And you can also leave us a comment in the section below here too. Have a great day.